Hope you're fine. Today video is related to bad breath or halitosis, which is a social dilemma and a social repellent. There are various causes of bad breath. The most common cause is bad oral hygiene, white coating on tongue surface, and any oral disease like gingivitis, periodontitis, any infection in the mouth, or any tooth decay which give chance to food infection and ultimate bacteria population survival in that area. There are systemic factors too in this condition like tonsil stones, pharyngitis, throat infection, stomach infection, lungs infection, other body part infection can also lead to bad breath from the mouth. And some medicines even like metronidazole causes bad breath from the mouth. And especially the food like garlic, onion, soda, alcohol also cause bad breath from the mouth. And one thing which is very common in males is cigarette smoking also have a very strong impact on bad breath. So there are various causes of bad breath. How to manage and how to treat these causes at home, at dentist place, and what are the latest modalities related to bad breath. So if you are new to the channel, kindly like and subscribe the channel so that further information will be delivered to you. First of all, the primary step of treatment of bad breath is good oral hygiene. How to boost up your oral hygiene. The first step is proper toothbrushing. The simple tool, a soft filamentary toothbrush twice a day is very important, and you can check it with plaque disclosing agent, a simple tablet place in your mouth and swish around your mouth. Then you will see in the mirror the areas which are skipped during the toothbrushing. Second is you can connect your toothbrush with your mobile app, which is a real time app, and you can check the movement of your toothbrush, the areas which are missed, and what is your performance during the toothbrushing. So it is in digital format, the way of toothbrushing evaluation and ultimate resolution of bad breath. Second thing is if you brush regularly twice a day but still you have a problem of bad breath, then you must apply a dental floss between your teeth, a simple thread, a dental floss between your teeth and remove the food infection between your teeth. The second most easiest is floss pick. Place between the teeth and remove the affected food so that the problem of bad breath will resolve. Third thing that is very important is tongue scraping with copper scraper, which remove the bad bacteria over the tongue surface and convert the balance of good bacteria in higher proportion. Another important thing, if you are wearing any artificial tooth like dentures, braces, you have to clean them as well because these are also sources of food infection and bacterial growth. The second important thing which is very cheap is use of water. Increase intake of water can also reduce bad breath from the mouth. Third thing is avoidance of food that can cause bad breath like onion, garlic, soda, alcohol, smoking. Instead, you must prefer fresh fruits and vegetables in your diet that will be beneficial to your body too. The fourth thing is use of herbal items like mint, green tea, clove, oil pulling with coconut oil, and peppermint you can also use. So these are also effective in reducing the bad breath for short term. As I previously described, the main thing is poor oral hygiene. which you have to convert with good oral hygiene with the proper brushing technique and flossing technique. Another important thing is teledentistry. The doctor away from the patient can treat the problem bad breath with questioning and answering and by evaluating the patient on a video call. So it's also very important during the era of COVID-19. Another important thing is mouthwash like chlorhexidine mouthwash, cetyl pyridinium chloride mouthwash, and in latest technology there are nanoparticles filled mouthwash which can penetrate in every and each area of the mouth and can kill the bad bacteria. So these are very important items for reducing the bad breath. So always use these things. These are very easy and can immediately resolve the problem of bad breath. Another important thing is probiotics, which we also use for GIT and other abdominal problems. Probiotics like lactobacillus is very efficient in reducing the bad breath and improving the level of good bacteria. Easily available in yogurt form or any pharmacy tablet form. So probiotics also are very important in reducing the problem of bad breath. If after all these treatment like good oral hygiene, proper toothbrushing, dental flossing, tongue scraping, usage of mouthwashes, still you have problem of bad breath, then you have to consult with other medical specialists. Maybe you have some other problem of ENT, throat infection, stone in the tonsils, laryngitis, pharyngitis, stomach problem, intestinal obstruction. So it's better to consult with some other consultant in this scenario. And even after that, some patients claim of bad breath, then it may be halitophobia or pseudohalitosis. In these cases, we refer the patient to psychologist or psychiatrist to counsel them that there is no bad breath as other person is not perceiving that bad breath. Hopefully this video is helpful to you. If any question related to bad breath and its treatment, you can ask in the comment box. Thank you.